Hello and welcome back to the Patient First podcast. I'm your host, Dr. Bryan Laskin, where, of course, we are looking to put patients first. And I'm so glad that you're here. Today we have a new segment that I'm really excited to talk about. It's still relatively early in the year. And so I want to talk about the top 4 tech tools that we should all be paying attention to when it comes to dentistry. Now, a lot of these tech tools are not just for dentistry. They are ubiquitous around planet Earth. As we all know, dentistry is behind the times, and not slightly behind the times, right? A lot of dental practices are actually 50 years behind. They're still using paper forms and all sorts of stuff, but that's not what we're talking about today. Today, we're talking about the things that if you are in dentistry, or if you're involved in healthcare, or if you're just a glancing member who goes to the dental practice, what things in the year 2023 should we be paying attention to? Number one is my personal favorite, one that I've been working on for the last, I'd say, 8 years. I can't not put this as number one. One of the reasons why it's number one, admittedly, is because I am most focused on, and that is interoperability. Big word. What does it mean? It means that the data in the electronic dental record, in your patient record, belongs to the patient. Fundamentally, that's what it means. And so what that unlocks is the ability for the patients to access their data, manage their data, permission it based on their desires and medical necessity, which in dentistry is completely broken today, right? And I'm working with the American Dental Association, some standards, primary of which is ODIN, the Oral Data Interoperability Network. Interoperability in medicine has already been a huge issue for about the last 5 to 10 years. I go to a lot of medical conferences. In fact, I'm going to the Health Data Palooza next month, or it's actually this month now. So hopefully I'll see you there in Arlington, Virginia. But basically it's secure, open sharing of data that protects people's privacy in healthcare. And it's vitally important. It is, I believe, the number one issue in dentistry that nobody talks about. We're dealing with it at Tooth Apps, where we're connecting all of dentistry. We're breaking people out of the data prisons that they're in. We're allowing it so that patients have access to data, dental practices have access to data. Innovative companies don't have to pay these exorbitant rates multiple times to these vendors who don't know how to innovate. And at its core, interoperability is allowing access to the people that own the data, being patients, manage the data, which is dental practices, and also excluding people that shouldn't have access to it. If I'm the CEO for a large DSO, I should not have access to all of the patient's information across 200 practices. That is how it's happening today. We're fixing that with Tooth Apps. We're fixing that with the ADA, with the ODIN standard, and it's going to fundamentally improve dentistry for the lives of all patients and dental practices. And I'm really looking forward to this. And we're making huge waves in this in the year 2023. So I think I can't not have that as number one. It is the biggest problem. After I sold Opera DDS to the great company Vine Dental and was thinking, what is the biggest problem I can solve in dentistry? We've had so much momentum in the last 12 months where we're going to be having the standard for public review very soon. We built out the engine to allow this to happen within Tooth Apps, and it's all coming together in a way that I would have thought it would have taken 5 to 10 years, and it's taken about 1 year to get this momentum. And so I believe 2023, the number one tech to watch is interoperability. I probably should have done this in reverse and ended up with number one, but alas, I'm no showman. I'm a dentist talking about the top tech tools. So I did it that way. So number one is interoperability. Number two is one that probably everybody else thought was number one, which is artificial intelligence, or AI. This was huge in dentistry leading into 2023, particularly with the radiographic AI companies, where they can read whether you have a radiograph. They also can tell you how many patients haven't had caries coming in that haven't been diagnosed, or that kind of thing. However, I think that AI is going to be much bigger than that. I believe in dentistry. Just look at what's happened this year with OpenAI and ChatGPT. If you pay any attention at all, it's all the rage, where you can have website copy or emails that actually is quite good. It's not great, but it's getting really, really powerful. So what does that mean for you? If you, let's say when you need to write a letter to a patient about something, ChatGPT or OpenAI or one of the other AI companies will be able to do that for you. AI chatbots on your website so that you won't have to have somebody managing those chats. It'll be artificial intelligence. That's coming very soon. It's actually out there already, but it's becoming very powerful to the point where you'll have a 24/7 AI bot that will be able to answer people's questions directly from your website. Stay attuned with the website companies like Tooth Apps, and we'll get you hooked up when the timing is right. Also, restoration design. Restoration already, if you use like a CAD CAM system, there is some type of AI that does the restoration design, but usually it involves some tweaking. Very soon, there's going to be no tweaking for any restorations. It's not going to require a human to think. The AI will be able to leverage that. So I think we're going to see AI leveraged in dentistry ubiquitously in all sorts of areas that we won't even know. And I think it's a good thing. You know, there's a huge labor shortage from labs to assistants and hygienists. And so being able to leverage AI to ease that burden for people, I like to think of AI as giving people superpowers. You know, if you think of the movie Aliens, where Sigourney Weaver had that robot thing that she's walking around in, AI can kind of do that so one person can do more work. And let's face it, that's needed in dentistry right now. Number 2, tech tool to watch is AI. Number 3 is teledentistry. Don't count it out. It's down, but it ain't out. We developed a teledentistry application at Tooth Apps 3 weeks when it was really hot during the pandemic. But I believe that people have pulled back from these teledentistry tools too much because they're so excited to get back in the office after the pandemic. It's being leveraged huge, telemedicine and mental health. And there are aspects in dentistry where you can leverage this today and it makes all the sense in the world. Triaging emergencies or doing virtual consultations with patients should be able to use it all the time. If you have a new patient coming in, why not have a teledental consult first so that you can make sure that they're the right fit for your practice? If you provide teledentistry consults for people prior to them coming into your office, it's such an easy, safe way for people to get to know you. And when they do come in, guess what? They'll be more excited about your office, more excited to meet you in person, and more likely to follow through with treatment. TMD, a lot of temporomandibular joint disorders. Let's face it, it kind of comes down to mental health almost. It comes down to coaching and anxiety reduction. That can all be done via teledentistry. Orthodontic follow-ups, you don't need somebody oftentimes to come into the practice to know, is there aligners all the way down? You could do that through photos or video via teledentistry. And follow-up for treatments. Why do follow-up phone calls when you can do follow-up teledental visits, either asynchronously by sending them messages, communicating that way, or if they have an issue, just hop on a quick teledentistry consultation. I think teledentistry is something that most practices should be looking at much more than like robotics or 3D printing right now, because it can be leveraged in pretty much every practice. So I don't think people will be checking out teledentistry. I think it's one that people should be checking out. That's why it's at number 3. Number 4 is payments. Payments need to change in dentistry. Let's face it, payments are broken. Sending people a bill in the mail. The only people I get bills from in the mail are the most archaic systems in the world. The guy that changes my doc sends me a bill and it's moronic. And I think, gosh, those doc guys are just behind the times. That's not how we want dentistry to be. Give people the ability to pay right on your website, text and email payments. Insurance payments are going to be changing massively. I believe there's going to be more transparency in insurance, more artificial intelligence. Our number 2 tech will be leveraged within dental insurance. And it's changing a lot, but I think probably leading into 2024. I think payments in dentistry in 2024 will be a big deal, kind of along the lines with number 1 with interoperability that will filter down into making payments easier in dentistry and better for everybody. I mean, this isn't just for dentists, making it easier and more transparent to see what insurance is paying for and how to pay your bill, more flexibility in payments. All of that is coming. If you read the title of the top 10 tech things to watch in dentistry, you probably weren't thinking about most of these, except for maybe AI. So again, my list is number 1, and a big number 1, meaning that the other ones are far behind it, is interoperability, data management in dentistry, so that patients and dental practices are not locked in these data prisons electronic dental records are today. Number 2 is AI. 3 is teledentistry. and 4 is how payments are made. Thank you very much again, as always, for being here on the Patient First podcast. And of course, I look forward to seeing you right here next week.